Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. Dr. Pane, this question of the week comes from Instagram, and the question is, will a facelift fix a sagging jawline? Dr. Pane, what would you suggest in this situation?
Yeah, it's a good question, and there's been recent media reports about Instagram and some of the other social media platforms and the qualifications of the people on them. That's a separate topic for future time. But in this case, in fact, it came from Instagram, is interesting because this person was talking about jowling or a contour here. We have these ligaments at the side of the, basically at the corners of the mouth. And when you get tissue sagging over the side with age, hasn't happened here yet, but eventually, then that's the kind of patient that a facelift is going to help. Now, this person, this is a very young person. I would say, looking at the photo, she can't be more than her early 20s and might even be in her late teens. That is way too early for a surgical facelift. And I bring up the qualifications issue because, especially here, in South Florida, there's a lot of people that do this kind of work. If you go to enough consultations, you might get offered a surgical procedure, which is not going to be in your best interest. And that's what I feel would happen in this case. Now, there is a little bit of a contour break there. I think it may be the way the picture was taken or just perhaps her own personal anatomy, but that does not mean that a facelift procedure is indicated here. There are some things that can be done, though, that might improve it to some degree and do not carry the kind of downsides that a surgical procedure does. There are various types of skin tightening mechanisms or devices that can be used. You can do radio frequency and other similar types things, which will not cause damage, and they may improve that area. Now, there's also a possibility of doing a filler around the area of the contour issue that she doesn't like. I'd have to see her in person to see if that would really be something that could be offered here. And there's a couple of other things that might be reasonable that can kind of improve her face or refresh the skin in ways that would not have the downsides of doing too early a surgical procedure in somewhere where it's not indicated. That doesn't mean that young people can never be candidates for facelifts, but it's usually in special circumstances. The most obvious example being someone that has gained a lot of weight and lost a lot of weight, sometimes with the aid of bariatric surgery. In those cases, younger patients might have skin elasticity that has been lost, and I would consider those people on a case-by-case basis. But by and large, somebody who doesn't have that kind of special circumstances, a routine facelift would not be something we would be talking about. We would be more concerned about one of these other non-invasive options, so that you could get some benefit without the downside of getting into surgery, too early, where you're too young for, so to speak.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our Facebook page, website, Instagram, or Twitter account. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great. Take care.